Hello and welcome. I'm your host, Neil Howard. Thank you so much for returning for another segment of Health Professional Radio. We'll be speaking with Dr. Catherine Tomasino. Joining us here is co-director of the Behavioral Medicine for Digestive Health program at Northwestern Memorial Hospital in Chicago. She's going to talk about the importance of identifying the causes of problems with gut health, treatment options, and some tips to help treat the condition. Welcome to Health Professional Radio. Dr. Tomasino, thank you for joining us.
Thank you so much for having me today.
Explain to our listeners what some of the factors are that affect our gut health.
So there are a number of factors that can affect gut health, everything from diet to genetics to different lifestyle factors. The factors that I focus on as a GI psychologist are really primarily brain, gut, and behavioral factors that can impact our digestive functioning.
Now, are you talking about how the brain affects the gut because it's another organ that's controlled by the brain? Or are you talking about actual psychological issues that affect gut health?
That's a great question, and the answer is both. So when I talk about the brain-gut factors, I'm talking about this brain-gut connection or the brain-gut microbiome axis. For those not familiar, this is this complex pathway of communication that goes both ways through the nerves and the nervous system and neurochemical signaling. And that pathway can become dysregulated or dysfunctional. So in essence, it stops working the way that it's supposed to. And we help address and improve the functioning of the brain-gut connection. One of the big factors that can affect the functioning of the brain-gut is stress. And we usually think of stress under the umbrella of a psychological factor, but stress is also a physiological response, maybe stemming from the environment or psychological factors. So we're both talking about that brain-gut communication pathway as well as the role of stress and how stress can impact that.
So anyone at all is susceptible to this condition?
Anyone at all is susceptible to the impact of stress on our digestive functioning. And, you know, we feel this, we know this day to day, right? We have it throughout our language. We have our stomach tied up in knots in an emotional situation. We talk about our stomach churning. And that's a reflection of that brain-gut connection and how stress can impact it. You know, that said, people with chronic digestive health conditions do experience the impact of stress more intensely, and it can affect their gut functioning in a different way and really impact their symptoms and their symptom experience.
So are we talking about the possibility of replacing stress reduction with maybe medicines for gut health, or are we talking about maybe changing the diet and reducing stress and eliminating some medicines, or is that even the goal?
You know, it depends on the patient. I would say a lot of my patients actually have multidisciplinary treatment approaches that include medicines and medical interventions, dietary factors, as well as addressing the brain, gut, and behavioral factors. So some patients do have the goal of eliminating medications, and that's why they come to see me. But for a lot of patients, we use a combination of these things. Sometimes the medical intervention just isn't enough because of these brain-gut factors and the impact that stress and response to symptoms can play. You know, there's also the possibility that a person is experiencing hypersensitivity of the nerves throughout the GI tract, causing signals to be sent very strongly to the brain, and the brain can turn the volume up on that. So they might be experiencing significant pain, but medical workup isn't revealing why they're experiencing those symptoms. You know, we tell patients it doesn't mean that they're in their head. It may just be nerve-based, and those are also things that I treat. Medications and psychological treatments can help with that.
Understanding that every patient is different, are there any general steps that can be taken to help that will work basically in any situation, at least as a jumping off point for treatment?
Absolutely. So, you know, a lot of people don't have access to a specialist like a GI psychologist. I do very particular, targeted, GI-focused treatments that have evidence behind them. But we also know that some of those changes are changes that can just be made in everyone's daily life without the input of a professional. So one of those things, the kind of a broad category, is any sort of stress reduction technique or a technique that can target the body's physical stress response. Usually when we talk about stress reduction, people think, oh, they're asking me to get rid of the things causing the stress. And for most people, that's not possible. But that's not actually what we're referring to. We're talking about a way to reduce the physical impact of the stressor on the body. So those are things like relaxation techniques, deep diaphragmatic breathing, not just taking a few deep breaths, but really getting into a routine of this correct diaphragmatic breathing every single day. There are a number of other ways that you can reduce the impact of the stress response through the nervous system using relaxation techniques like mindfulness, yoga, exercise, and movement. All of those things can help. And I also tell people this time of year, it's very easy for our lifestyle, our routines to get thrown off. We might go long periods of time without eating. We might not be getting as much sleep. And prioritizing some of those things, regular meal schedules and sleep schedules, not going all day and then having a really big meal at night, watching how much alcohol we're drinking or other substances, all of those things can play a role in improving digestive health.
How often does a change in diet, for lack of a better term, maybe turn off the brain's gut response to stressors?
So are there diet changes that we can make to improve kind of the brain-gut functioning and how our brain is responding to stress?
Absolutely.
That's a good question. So, when we think about dietary interventions, that's one of the first things that people think about. They have a stomach ache, they have diarrhea, they have constipation or reflux. They think, what did I just eat? And diet can certainly impact things. And so can stress. So sometimes people are quick to assume it's the diet, and it may not only be diet, or it may be diet plus stress. So I think that's one thing that's really important to think about. But in terms of the interaction, which I think is what you're getting at, between diet and stress and gut functioning, when we're thinking about really focusing on foods that are less highly processed, that's really what we're looking for. There's no one specific diet in general that has been shown to be the best diet for digestive functioning across different conditions. There are a couple very targeted, evidence-based dietary interventions people can try, but some of them are very restrictive, and people forget the add back in phase. For example, the low FODMAP diet can be very effective in treating IBS, but the point isn't to stay on the low FODMAP diet forever. It's to also add things back in. And many of my patients do still experience the impact of stress on their symptoms, even following a very strict low FODMAP diet. So I think limiting the highly processed stuff is really the best advice we can give, because that can both impact the stress response as well as our gut functioning.
Could you tell our listeners more about the Northwestern Memorial Hospital's Digestive Health Program?
I'd love to. I'm really proud of our program. It's the largest GI psychology program in the country. We have 5 clinical psychologists specializing in GI or digestive health. And then we also have a brilliant research psychologist who focuses on developing and evaluating novel and new interventions for psychological and behavioral treatments for digestive health functioning. So we're a very big program. We work right alongside the medical providers, the gastroenterologists, hepatologists, and APPs and dietitians, and we work really well together as a team.
Well, is there anything that you'd like to add for our listeners? And then give us a website where we can learn more.
Absolutely. The fact that some digestive health conditions, things like IBS, IBD, reflux, actually have psychological and behavioral treatments that target those symptoms specifically, and that's what my team provides, what our team provides at Northwestern. So those are things like cognitive behavioral therapy, medical hypnosis. So if that's something that you're interested in, you can learn more about those treatments on our website, NM, like Northwestern Medicine or Northwestern Memorial.org. So you can go to nm.org to learn more about our program and these types of treatments.
Catherine, I appreciate you lending us some of your time this morning. Thank you so much for joining us here on Health Professional Radio. Thank
you so much for having me today. It was my pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Catherine Tomasino. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.